My name is Michael Maylahn. I'm the founder and CEO of Stasis Labs, and essentially we're a remote patient monitoring company. We have a hardware and software solution that has all gone through the FDA approval process. And essentially the idea is that we monitor 6 different vital signs of patients, as well as collect other information about how they are doing at the bedside. This can be in the hospital, in an outpatient facility, or in the home. And then we very simply get all of that patient status to our mobile app and our web app that allow nurses and doctors to, in real time, see how their patients are doing, know when an issue might be coming up, and be able to intervene faster than they otherwise would. For myself, I was just always so baffled how access to quality healthcare was so different based on socioeconomic class and geography. And I feel like where technology is right now is a really unique time period to change that. And so that's kind of been my general driver for ourselves, really kind of to answer your question around what was kind of this core problem we were solving. My co-founder, Dinesh, is an EMT. He's trained in knowing when something's going wrong with a patient. But we were in a situation in the 4 walls of a hospital where there was doctors in the building, nurses on a floor, and a trained EMT right next to the patient, yet no one knew something was happening. And if they had a monitor on them and saw his oxygen levels were going down, they could have put him on oxygen and he'd still be alive. And so there's this clear information gap between how patients are doing and what the nurses and doctors know. And that information gap is really the reason why for the last about 8 years, we've been working to try to really reduce that information gap. So this is actually our monitor right here. It looks very different than probably any vitals monitor that you've ever seen. We took all the numbers and waveforms that you would normally see, and we moved it to a tablet, which I'll show you in a moment. And so this is what sets at the bedside of the patients, and it's very, very simple. It's just different icons for the vital signs. Green is good, and yellow is a warning. And so I'm gonna just put it on my finger right now so you can kind of see what it looks like. But essentially, this is the hub that collects the data and sends that data to kind of the cloud for remote access, but everything else is done on a tablet, and the tablet is kind of like acts as the controller to the system. So I put this on my finger. You can see my heart rate and blood oxygen are being red, and green shows everything is good, but that's all you can see. And so we have our tablet, which sits right at the bedside as well, and you can see that the readings are coming in. My heart rate is 67, my blood oxygen is 96, and anything else comes in right here as well. And so this is kind of like the controller. It has everything coming in here. And you can do everything you normally would do, from alarms to live vitals to trends. Absolutely everything is here. And then that all goes up to our web and our mobile app, where the nurses and doctors are able to see all the numbers and the waveforms and trends, as well as get alerts. Like, for example, if a patient's going out of range or is at high risk, we have kind of a risk scoring system. And so really at the end, what all of this does is it allows the nurses and doctors to know which patients are at risk and have some information to do an intervention earlier than they otherwise would know. And then lastly is just the cost per patient is often pretty prohibitive. And so we ended up choosing to integrate just gold standard hospital probes, the ones that they've been using for 30 plus years. And so we use a standard pulse oximeter, a standard blood pressure cuff, et cetera, is kind of our base package of delivering vitals. Although we are starting to integrate other third-party sensors in if they want to be adding in other sensors. Our goal was not to innovate in data collection. Our goal was, once we get the data, how do we make it incredibly simple to get that to the right nurse and doctor at the right time, display it all very carefully, and how do we start using that data for more kind of predictive purposes? So that's kind of where we have focused our R&D efforts. It all comes down to the use cases. So, and there's kind of almost 3 sets of players. So in terms of use cases, there's hospitals, there's like outpatient facilities, and then there's the home environment, right? And obviously each of those use cases, there are some different players that play in those. In all kind of the facilities, it's mostly the major kind of incumbent players. But I think it's important for innovators in digital health to remember what they are, which is their tools, right? We are providing digital tools for our practitioners, our nurses and doctors, to be able to deliver care. And so I think it's important to always remember that we are a tool. We're not providing care. We are a tool to allow people to provide care. And I think why I say that and why that's so important is it's important to, whatever you're innovating for, to meet the patient and the clinician at where they are and try to understand incremental things that you can do to start improving it without completely changing all of their workflow and all of what they need to do. It's stepwise change. And I think that's really, really important.